Good afternoon. I have with me Dr. Bermeo. She's of Rush University. She is also our chair of the Professional Advisory Board. So I've asked her to join me, Ayesha Akhtar, Director of Education, to answer some of our frequently asked questions by people living with epilepsy. So thank you for being here this afternoon.
I'm very happy to be with you, Ayesha. It's good to stay connected in these times of social distancing.
Yeah, this is definitely a new way of doing things for sure. A lot of our meetings have been virtual like this. So I'll just ask you a few questions, and then I'm going to ask you if you can also repeat your answer in Spanish as well for our Spanish-speaking population.
Absolutely. Muy feliz de comunicarme en español también.
Bueno. So number one, the biggest question is, should clients are asking, patients are asking, should I keep my routine appointments for my epilepsy? How should I manage epilepsy in these times?
I think the most important message is that these are challenging times for all of us. So we are in the middle of an unprecedented health situation in a healthcare environment, and we have to be smart about how to take care of ourselves, how to take care of our loved ones, and also how to take care of others. So right now, most of the institutions are trying their best, and we know that we have excellent institutions, epilepsy institutions all around the Chicagoland area, and we are trying our best to be able to keep the social distancing, limit the public contact with potentially for people to limit their exposure and potentially the possibility of getting any infectious disease at this time. So many of our clinics have transitioned to either through different ways of telehealth. Sometimes telephone encounters, telephone visits, sometimes video visits, which is a very nice development. Some of our clinics continue to be open, at the very least for emergency situations. So it is important to note that the hospital is still a safe place, but we have a lot of measurements in place. I would advise all our clients and patients and friends to rather call their provider or call their clinic before they just show up for their appointment, because it is very likely that all the clinics are transitioning to some way of either telling them that they are stay open for inpatient, for personal visits, but they are going to probably do some screening. I think we should all expect that in any activity that we're doing during these times, we will be asked if we have fever, if we are coughing, if we have shortness of breath, or any other symptom of respiratory disease. And it's possible that the provider is going to ask you to rather offer you the possibility, instead of coming to the hospital, to have the visit over the phone or to have the visit over video, or or just answer your question, or answer your problem right away on the spot. So I think this is a time to maybe ask, do I really need to see my provider? What is the question that I have at the time? Is this something that we can solve in any other way? Right. I would say from all the physicians in the Chicagoland area, we want to stay connected. We want to continue to answer to your needs. You're not alone in this. We are all in this together. I know the Epilepsy Foundation, maybe not from our base office, but from all our homes and offices all around the region, are staying connected and staying together, so that we come out of all of these crises maybe stronger and more closer to each other than ever before.
Great. And if you could say that en español también.
Absolutamente. La pregunta fue si en estos días que estamos en la crisis del COVID-19, los pacientes deben ir a la consulta con su doctor. Y la respuesta es que depende del caso y depende del doctor y del paciente. Yo creo que en este momento lo mejor es no necesariamente ir a la visita regular, pero llamar antes a la oficina y preguntar si el paciente necesita venir en ese momento. Es importante considerar cuál es la razón para la visita, si es una visita regular que de pronto se puede poner en la agenda para otro momento después, si necesita medicina, si tiene una pregunta o una emergencia. La mayoría de las oficinas continúan abiertas en alguna capacidad, por lo menos para emergencias, y algunas de nuestras oficinas están ofreciendo visitas con los doctores de manera telefónica o en video. o puede resolver su pregunta en el momento.
Sí.
Todos debemos esperar cuando llegamos a una oficina en estos días que vamos a tener que responder algunas preguntas, como si tenemos tos o fiebre o enfermedad respiratoria, y también es posible que le quieran medir la temperatura antes de venir. Esas son cosas diferentes a lo que estamos acostumbrados, pero la idea es mantenernos todos sanos, limitar el contagio de la enfermedad que está circulando. Es el momento de cuidarnos a nosotros mismos, a nuestros seres queridos y a los demás. Junto con la Fundación de Epilepsia, los diferentes centros de epilepsia en el área de Chicago, las familias y los pacientes y todos nuestros amigos debemos trabajar juntos y mantenernos en la distancia social que estamos observando ahora, más unidos que nunca.
Gracias. Bueno, great. So I know there's a lot of conversation about certain types of people who are maybe high risk factors, especially immunocompromised. Are people with epilepsy at a greater risk for COVID-19? And also, does it increase the rate of seizures by contracting the coronavirus?
Well, we know that epilepsy is a very diverse disorder, right? So we have some patients that have different conditions that facilitate or are associated with the epilepsy. Epilepsy by itself is not necessarily a risk factor for developing the severe presentation of this disease. However, we know that we have patients that do have other conditions that can make a severe presentation more likely, such as patients with weakness, limitations in movement, difficulty swallowing in the way that maybe food or secretions can go to the lungs. And we also have some of our epilepsy patients who are on immunotherapies, such as sometimes patients with tuberous sclerosis who take some medications that may be immunotherapies, steroids, ACTH for kids with severe forms of epilepsy. So in general, the answer is not necessarily. I know that the World Health Organization and some other entities have defined maybe neurologic diseases as a whole as part of the increased risk. We don't think that epilepsy necessarily has to have an increased risk for a complicated course of the disease, but some of our patients are maybe more vulnerable.
Right.
Your second question was, does it manifest as seizures? Actually, not that we know of right now. We don't see seizures as a big complication of the disease right now.
That's good.
En español, la pregunta es si los pacientes que tienen epilepsia tienen mayor riesgo de tener complicaciones con la enfermedad de COVID-19. Y la respuesta es no en general. Como sabemos, epilepsia es un término que abarca muchos tipos de enfermedad, de muchas diferentes etiologías o causas. En general, no pensamos que la epilepsia por sí misma represente un riesgo mayor para nuestros pacientes. Sin embargo, tenemos que saber que algunos pacientes tienen otras condiciones que sí pueden predisponerlos a una enfermedad más severa, como problemas en la deglución o problemas al tragar. Algunos pacientes no pueden pasar muy bien y pueden tener aspiración a los pulmones, pacientes con debilidad, problemas de movilidad o que toman algunas medicinas que pueden disminuir el efecto del sistema inmune o que están inmunocomprometidos. Esos pacientes pueden estar en mayor riesgo, pero por solo tener epilepsia, no que sepamos hasta este momento.
Bueno. We had one very specific question come up in regards to, so obviously in the umbrella of SUDEP, it's on people's mind all the time. Is that risk increased now under the umbrella of COVID-19? Is there an increased risk of SUDEP?
I think the main question, the following question to your prior question was if the COVID disease can worsen epilepsy.
Right.
And I do think that is a consideration to have. Because we know that there is a group of our patients, I would say many of my patients, who really get more seizures when they get sick. regardless of what it is, right? When they are dehydrated, when they have fever, when they have a urinary infection, a pneumonia, of course. So I do think that patients with epilepsy who get these infections that may be febrile or moderate severity may be at a risk of having more seizures. And if they have more seizures, of course, that increases the risk of all the complications that come with seizures, including SUDEP, unfortunately, right? We know that the best way to prevent SUDEP is to prevent seizures, big seizures. So I do think that our patients need to be extra careful during this time. And this is not meant to cause panic or increase the anxiety that we are already feeling all over, but just to rather take the opportunity to be even more mindful, more responsible, more organized, that we are living in different circumstances that we do on a regular time, right? So we are all with different routines. We don't have a specific schedule. Maybe mom is not going to work, so she, I see in my patients that every time they change their routines is when we are more prone to missing medication doses, to take them late, to forget when to take them. I think this is a time to make wellness and healthcare a priority, because I need to tell my patients these times, we really need to keep you out of the hospital right now, because the hospitals are overwhelmed, and with not all hospitals, but I wouldn't say even overwhelmed at this time, but they expect a lot of patients coming to need their services. So as we prepare to take care of more patients at this time, we want to make sure that our patients stay protected, stay out of harm's way, stay out of any contagious diseases at this time, so that we can just keep providing the services that we are providing. So I think the risk of SUDEP is probably more tied into the risk of seizures. I have not seen yet, or we have not seen yet, that there's an increased risk for SUDEP, particularly linked to this condition.
Great.
En español, la pregunta es si los pacientes que tienen epilepsia tienen un riesgo mayor de muerte súbita en epilepsia o SUDEP asociada al COVID-19. Y en realidad tenemos que saber que esta es una enfermedad infecciosa que produce fiebre y tos y dificultad respiratoria, y igual que otras enfermedades que producen infecciones en la orina, en la vía respiratoria, o que producen fiebre, pueden aumentar la probabilidad de crisis, y con las crisis pueden venir complicaciones como la muerte súbita. Lo más importante es acordarnos de, en estos días que cambiamos la rutina, hacer una prioridad de tomar los medicamentos, de dormir suficientemente, de comer bien, de estar hidratados, de tomar las medicinas a las horas para tratar de prevenir ataques. Y como estamos previniendo ataques, también estamos previniendo que haya complicaciones de los ataques. No sabemos en este momento que el COVID promueva más SUDEP en pacientes vulnerables o pacientes con epilepsia.
Bueno, great. I just have one last question for you, and then if there's anything after that, you're welcome to add as well. So right now, we at the Epilepsy Foundation of Greater Chicago, as well as Epilepsy Foundation of America, are not aware of any sort of shortages in medication. But when you and I were talking on the phone, you had some really great advice for your patients, our clients, about how they can kind of create a stash of medication at home. What do you recommend in terms of medication management at this time?
So I think at this time, we have to, it's never enough to hear all the measurements we have to take care of ourselves. So wash your hands regularly. Stay home if you're sick. If you develop any respiratory symptoms, call your doctor right away and discuss what is the best way to manage your symptoms. But particularly for patients with epilepsy, it is important that you know that you have at home everything that you will need if you were to get sick, particularly something to handle fever. We're thinking acetaminophen or paracetamol is the best right now to take. Remember that you may be susceptible to some over-the-counter cold medications, like the ones containing diphenhydramine. So run by your doctor. If you have your cold medication and you want to take it, before you do that, run that question by your doctor, because we don't want to improve your cold but worsen your seizure.
Right.
And very importantly, make sure that you have enough medications and that you put in place every possible reminder that you can have. In my clinic with my patients, we like phone alarms because they are reminded on the same times, and the phone doesn't matter if there's a work day or not a work day, or if we're in quarantine or in vacation. The
Right.
phone will always remind you. The rules for my patients is you can snooze the alarm while you go get your medication, but you cannot dismiss it until you have swallowed the medication. And that makes us very, very, very well compliant. Make sure pill boxes are usually helpful as well. Then nobody has to remind you. You can do it on your own. Make sure that you took your medication. Make sure that you have enough medications. Actually, right now we have had some new regulations that allow the pharmacy and also your insurance company, possibly according to your insurance, there's some more flexibility in getting higher number or count of pills so that you know that you have what you need. Make sure that you have the number of your doctor at hand. Make sure that you are overly careful during these days. We have the priority of having you safe at home so that we can go and take care of other patients that need us right now. But we want to make sure that we are also taking care of all our patients and all their loved ones. And we will get out of this healthier and more together than ever. En español, estos días son importantes que nos cuidemos. Tenemos que acordarnos siempre, así lo hayamos oído muchas veces en la televisión y en la radio y por todas partes, lavarnos las manos es muy, muy importante. Varias veces al día. Si estamos enfermos, por favor, quédense en su casa, tenga el número de su doctor y llámele para que le ayude a entender cuál es la mejor manera de cuidarse en ese momento. Es posible que solo tenga que estar en la casa y monitorear sus síntomas, es posible que tenga que venir a tomar un examen, es posible que tenga que ir a la sala de emergencias si tiene problemas para respirar. Para nuestros pacientes con epilepsia es importante que tenga las medicinas que va a necesitar si tiene un cuadro gripal o de flu, que tenga acetaminofén o paracetamol para manejar la fiebre. Tenga cuidado que algunas medicinas para la gripe pueden empeorar los ataques. Si tiene la medicina para la gripe, mejor llámele a su doctor y pregúntele si está bien que la tome o no. Algunas, como la difenhidramina particularmente, pueden empeorar las crisis en algunos pacientes. Asegúrese que tenga suficiente medicamento en su casa para estar los días que va a estar. No queremos que deje de tomar la medicina y después tenga una complicación de sus ataques. Queremos que esté bien. Acuérdese de recordar de tomar su medicina, aun si su horario del día ha cambiado. A mis pacientes les funciona muy bien usar los recordatorios del teléfono, porque cuando suenan, los pacientes pueden apagar la alarma por un poquito mientras se toman la medicina, pero no la eliminan hasta que no se la hayan tomado, y eso nos ayuda mucho. Los pastilleros nos ayudan mucho. Es importante tratar de estar lo mejor posible, dormir bien, comer bien, no preocuparnos mucho, aunque es un tiempo de mucha ansiedad para muchos de nosotros. Desconectarnos un poquito de las noticias para centrarnos en nosotros mismos, en cuidarnos a nosotros mismos y controlar lo que podemos controlar, porque hay cosas afuera en el mundo que no podemos controlar ahora.
Sí, very good. Bueno, thank you so much. This was all I wanted to ask you. Was there anything else that you would like to add?
I think the other important message is that we are all here for you. The Epilepsy Foundation is there for you. We are here for you over the phone, over video. Do reach out to us. Don't feel it is a time that it feels lonely for a lot of people. Yeah. It feels lonely in our house. It feels isolated. Yeah. But right now the world is more connected than ever. And as you are home watching this video, know that we care about you, that we want you to be well, that your well-being is important to all of us as a community, because that's what we are. Yes. So let's stay connected in the distance, stay healthy, wash your hands, and see you on the other side.
Fabulous. Thank you. On behalf of the Epilepsy Foundation of Greater Chicago, I just want to thank you so much again for your time, Dr. Bermeo.
Thank you, Ayesha. As always, it's a pleasure to be with you guys. Stay healthy.
Thank you. Stay well. Take care.